Hey YouTube. This is going to be part 2 of the hospital and pain and all that stuff. I'm so sorry that that video cut off so abruptly last time, and that I wasn't able to get to part 2 like I thought I would that night. My pain kind of not spiked a little bit, but it wasn't too bad. But like I said, I was trying to kind of wean myself off of the pain pills because it can kind of cause difficulties with breathing. And I already have asthma, so I was trying to be really careful and aware of all of that stuff. So what was that, 2 days ago that I did that video, and things are so much better. I mean, even every time I go to sleep and wake up, things feel so much better. Like today, I can almost function normally. Obviously, it still is uncomfortable and painful, and I'm still trying to be really careful with the activities I'm doing. You're not supposed to lift over 10 pounds, which I keep forgetting. Not that I'm lifting that much, but I mean just opening and shutting windows, because we open our windows at night rather than trying to run the AC. But I mean, even doing that, I realized I probably shouldn't be doing. I've been doing it slowly and carefully, but at the same time, it's probably more than 10 pounds of pressure trying to get that stuff open. So just trying to keep all those little things as a reminder, and all that stuff it can be difficult. But like I said, it's not hard. The pain, I haven't taken, I think I took pain pills once yesterday, and then I took half a pill to go to sleep, and it's now the next morning, several hours into my day, and I haven't taken any pain pills. Like, I don't feel like they're really helping anymore, because the pain itself is pretty much gone. It's still just that soreness, and your abdomen ends up being so swollen. Everything inside is trying to heal and all that stuff that, I measured myself the day before surgery, which I recommend everyone does, because it'll help you kind of see as the weight goes down, the inches you've lost, even if you aren't necessarily losing a whole bunch of weight. Those inches are probably going to start shedding fast. So, but anyway, like I was saying, if I were to measure my abdomen today, I'm sure that it would be several inches larger than what it was the day before surgery. Like, you're so swollen. And that's really where the soreness and uncomfortableness comes from. It's not pain. It's just, like I said earlier, feeling like you got kicked in the stomach by a horse. So, a little bit more about my hospital stay. I was telling you guys the other day that I got to the hospital at 9:30. They didn't call me back till about 10, but they had me get in my gown and put my little sockies on, and get in the bed that they had me get on, and then they start your IV. And normally that's a fairly traumatizing event for me, but she got it on the first stick, so it was good. She poked my arm, let's see if I can show you, right here, like not in the joint here, but kind of, you guys can't see it all, but kind of on the side here. So it helped that, when I needed to bend my arms later, I didn't have an IV in the joint of my elbow. So I recommend to everybody who's still headed into surgery, see if you can't get them to not, well, and hands are bad too, because every time you go and move or do something, it kind of snags and pulls, and it's uncomfortable. I mean, you're on morphine for the first part, but you can still kind of feel it pulling and snagging. It's not a comfortable feeling. But so they got my IV set up, and then they went to give me my first shot of the blood thinner, and for whatever reason, the computer pulled up the undiluted heparin, which is what they were giving me for my blood thinner, and she gave me that shot, and it hurt so bad. That was probably more painful than setting my IV up. So be forewarned, if you do not get the undiluted version, you want the diluted version is what you want. So be forewarned that could hurt quite a bit. It's pretty fleeting. The pain was gone in a couple minutes, but it was still it was more uncomfortable than getting my IV set up. And then my parents got to come back, and I think at that point, like, it really is hitting home that you are about to go into surgery and that you could die. And I mean, I don't want you guys to worry about dying. I mean, 0.5% of people die, and you have to think about, like, most of these people. I mean, when I went to some of my courses, I saw people in their 70s there. So, surgery, the older you get, surgery becomes more and more of a risk. So if you're young and healthy, I use the term healthy loosely, but if you're young and healthy, the likelihood of you dying is pretty slim. Like, more often than not, people our age, I'm 26, I'll be 27 in September. The reason they die is because they don't follow the guidelines that they're supposed to. They're not getting enough water, they're not eating or drinking the fluids. I mean, right now I'm having my 2 ounces of chicken broth for breakfast. So, I mean, that's a lot of what my doctors told me, was that people my age don't die in the operating room. It's afterwards, when you're not doing what you're supposed to be doing and you're not following the guidelines that your surgeon has given you, which, by the way, I am surprised at how different every surgeon's guidelines are. Like, I am really happy that mine are fairly stringent. Like, for this first week, I literally cannot consume anything that I cannot see through. So I'm allowed to have water, which, by the way, I do not like water right now. Every liquid that goes in my mouth is flavored, which is totally fine, because I guess a lot of people have a water intolerance, if you will. They just, the flavor or lack thereof of the water kind of makes your stomach cramp. And I'll talk about a little bit more of that stuff. Like, I'll probably just make this a hospital video, and then I'll talk about stuff that I'm doing after, and all that stuff in a second here after this one. But, so I guess I'll get back to the hospital visit. So, my parents came back, and they were probably with me for 30 to 45 minutes max, and I got called back at 11:30 right away. But let me tell you, that 30 to 45 minutes that you're sitting there already hooked up to everything, and the people that you brought to the hospital with you are kind of like standing around your bed just staring at you, asking you how you're feeling. It's an intense moment, and those minutes go by pretty slow. I was definitely ready to just be done, get me into frickin' surgery right now. Like, you could tell that they're really worried for you, and you're worried for you, and seeing, like, my mom and dad were the people that I brought with me into surgery and everything, and my best friend ended up showing up after I went into surgery, so I got to see her after, which was awesome. But, they're sitting there staring at you, and you can tell how concerned they are for you, because this is major surgery. Like, it's a big deal. And because it's elective, it makes you kind of feel like you're doing this to yourself. Well, I mean, you are doing this to yourself, but I feel like that probably makes things a little more intense. I mean, if you have appendicitis, you're not going to think twice about taking your appendix out, right? Because you have to, or you'll die. So I think it's just a completely different feeling. But I'm already going on to 8 minutes here, so I'm going to get talking. So they wheeled me into the operating room, and they have you, at least my surgeon, had me stand up and get onto the operating table by myself, and it's this tiny little metal rectangle, basically. It's just a flat metal rectangle, and it's really small. Like, I was like, am I gonna fall off this? But I didn't fall off, obviously. And they strap you in, and they put your little heart rate monitor so you can hear your heart going boop, 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 boop. It's freaking out. And that kind of stressed me out a little bit more, hearing how fast my heart rate was going. So they had the anesthesiologist come in, and he was like, okay, well, we're going to give you some relaxing drugs right now. And that was the last thing I remember. I remember my nurses and all the people that were in there. They were talking about the weirdest things. They were talking about how, I don't know, it was work drama. And I was like, should I be hearing about your work drama right now? I want you to be focused on me and what you're doing. But it was fine. But when he gave me that relaxing drug, that's all I remember. I don't remember anything after that. But the anesthesiologist, they do intubate you, so they stick a tube down your down your throat so that they can breathe for you, to make sure that you don't aspirate on your own spit and everything like that, and choke and die. And because you're under so many intense drugs, like I said, like even the pain pills I'm on, I feel like are affecting the way I'm breathing. They have you breathe through this, maybe I'll show you in the next video, but they have you breathe through this weird little thing afterwards, you know, you have to do it 10 times an hour to make sure that you are not losing lung function, because the pain meds they have you on affects that. So I think that's about it. So they brought me out and they had me in recovery for 2 hours. I was in, take this with a grain of salt, ladies and gentlemen, but I was in so much pain when I came out of surgery. They don't want to overdrug you. So recovery is the whole point of getting your pain in check, basically. So, you know, I came out and I remember the lady asking, well, how bad is your pain right now? And I said, it is like a 9 right now. Like, and I have fibromyalgia, so I feel everything so intensely. I feel everything 3 times more than the average person. So she gave me a shot, and I quickly fell back asleep. You know, you're in and out of consciousness, mostly out of consciousness in recovery. And, you know, they came back like 3 or 4 more times, and I still said, I was like, I'm a 7, I'm a 7, I'm a 7. So that last shot, I think, finally brought me down to like a 4. And then they decided it was time to move me, which, by the way, is the worst. It was awful. It was awful. Every little bounce and jounce and everything is just jostling you, and it's really uncomfortable. That was probably the worst part after surgery, was being moved from recovery. But I'll tell you right now, like, I'm only saying that because that's what I remember. I don't remember the pain. They have you on so many drugs right at that point, that you don't really remember being in that much pain. It's not like you have this memory of horrible, awful pain. So I get to my room, and like I said, my best friend was there and my mom was there. My dad, unfortunately, had to go back to work because the surgery took 2 hours, which was, I felt like, a little bit longer, but they fixed my hiatal hernia, that where your esophagus and your stomach meet. I guess I had a hernia there, which is very common. They say something like 90% of surgery. I'm kind of making that statistic up, but it's a high percentage of surgeries that you have to fix that hiatal hernia. So that was really good. And then it was, like I said, 2 hours in recovery. So by the time I left my parents and by the time I got put in my room, it was 4 hours. So my dad just decided to go back to work, and I think that means surgery. So I went from surgery from 11:30 to 1:30, and then I was in recovery from 1:30 to like 3:30 or 4. It took a long time in recovery, almost longer than it did in surgery. And your parents are nobody's allowed to see you when you're in recovery, at least not at my hospital. So I came back out, and, you know, at that point, because they had just moved me, they had to give me more pain meds. But they hooked me up to the, I don't remember what it's called, PCP or something. That's not right at all, but where you get to, every time the button turns green, you get to push it, and it gives you a little bit of morphine. So I did that a couple times in a row. Every 10 minutes, I would push the button, and finally got my pain down to like a 2 or 3. And then they brought in my food, which I was really surprised at. I did not realize they were going to let me eat that quickly. I say eat with a grain of salt, obviously. They brought in a popsicle, which is, this was the best popsicle I've ever had in my entire life. And I had some broth, and I had some apple juice. And that was probably, in the hospital, that was probably the easiest eating that I had, was right out of surgery, when I was pretty high up on beds. And then after that, I went ahead and they make you walk. They want you to walk at least 2 times before you go to bed for the night. So I got up and did a lap, and I think I maybe walked, like, it probably took 5 minutes, because you have to carry your IV with you. And so getting everything unhooked and connected and all that stuff. Oh, by the way, those little squeezy things that they put around your calves to keep you from getting clots gave me the worst, like, Charlie horse muscle. My muscles were really sore for a couple days after surgery. So I'm going to warn you about that. And this is getting obscenely long. So anyway, like I said, I walked 2 times that night and then went to bed. And I woke up, and my mom and dad, they went home. You know, they came back and saw me. Dad came back from work and saw me. And then took off probably like at 8 o'clock at night, because I was going to end up sleeping the rest of the night. I was on good drugs, so I just figured sleeping would be the best thing for me, and it was. And like I said, I got released pretty early. I was out by like early afternoon on Wednesday, so and I had surgery Tuesday afternoon. So they only kept me 24 hours. I did what I was supposed to do, drank, walked, all that stuff. So let me just encourage you guys to do all that, and please, please, please leave comments, ask questions, whatever. I'd love to hear from you ladies. Thanks. Talk to you later. Bye.